first hospital on Kos Island.
Can you change anything in Bible? Can you add up anything in Bible? That is Organon.
Is there anything in tradition of healing in India that fits homeopathy?
Till diagnosis, we are sailing in the same boat. After diagnosis, we go ahead.
Hello, dear friends, homeopaths. My name is Barbara Liberowicz. This is Homeo Sapiens, and today we broadcast straight from Mumbai. My guest today is Dr. Kishore Mehta. Dr. Mehta, I met many of your students. I interviewed some of them, and they all talk about you with a lot of respect. So you are a very special person for them.
Yes.
Please tell about yourself.
Myself, I have been practicing homeopathy since 50 years. In fact, I was never to become a homeopath. I wanted to go for allopathic institution. But because I felt sick when the results were there and I could not get admission. So I got admitted in homeopathic college. And when I took admission in homeopathic college, I passed out and became a doctor. But still, I wanted to practice allopathy. It is only because my mother was too sick and we were not in position to invite doctors at home for my mother. There was no proper financial condition. And my brother told me that you will have to become a doctor by all means. So then I became a homeopathic doctor. And in homeopathic doctor also, I did not want to practice homeopathy and I just wanted to start allopathic treatment. Unfortunately, or rather fortunately, it so happened that I had no money to open a shop and start homeopathic practice, allopathic practice. I had no money. So then I joined homeopathic college as a teacher. And I started teaching. And fortunately, principal of my college at that time, Dr. Batra was there. He told me that in the evening you sit in my clinic. So morning I used to teach, evening I used to sit in his clinic. So teaching and clinical experience went together and that opened my eyes. That yes, there is something in homeopathy which is not there in allopathy or any other system of medicine. You see. And that insight made me to take a firm decision that I will practice only homeopathy.
So what exactly made you make this decision to practice homeopathy?
Various results that I saw in Dr. Batra's clinic, and then I got my basic teacher who really evolved me, Dr. M.L. Dhode, who was principal of my college when I was student. And because of him today I am what I am, because he taught me right homeopathic practice. A great man that he was. And now he has a big institution. Of course, he is no more there now. But it is only because of him I have evolved myself as a reasonably good teacher as well as a clinician.
How was your homeopathic practice evolving during these 50 years of your practice?
See, in India as well as in Mumbai, it was somewhere in 1975 or 76. Homeopathy was not at all known to people at all. And I just started practice sitting here. And no doubt initial years were very difficult because I was only surviving on the whatever amount I get from my college as a teacher. But practice was absolutely almost nil. Say one patient or two patients because people were not knowing anything about homeopathy.
Oh, really? I didn't know. So homeopathy became so famous, popular only later.
I'll tell you. Then it so happened that number of colleges increased in India. In Mumbai, there are 3 colleges. So more and more students coming up as a doctor. So more and more students come, so naturally homeopathic became more and more known to the people, And then after 5 years or so, gradually the practice started evolving, And side by side, I was also a teacher. And I was a teacher of homeopathic materia medica as well as organon and philosophy. So I had a good experience in both this so that I can apply in practice. And it is my teacher, Dr. M.L. Dhole, died. He pushed me and he inspired me how to practice homeopathy based on organon philosophy. He grinded me. He was a taskmaster, and I worked very sincerely with him, so much so that many a times I never used to go home also at night.
Yeah. Recently, I talked to many Indian homeopaths, and they are very principled about organon. In Europe, it is like everybody knows, we respect organon. Yes, we know, we study, but here, every second word is organon or Hahnemann.
Yes.
Why do you think organon?
In fact, I have written a book on organon, how to practice homeopathy through organon. That is my book. Book is not explaining anything about aphorism, not explanation of anything, except how to pick up the aphorisms in practice. That book I have written.
Yeah, and what is new? What was special about this book? What would you advise me now, quoting your book, for instance?
Yeah. See, this book will give you idea as to how organon evolved by Dr. Hahnemann. The various concepts that came out from first edition to the sixth edition, concepts were evolving. So those concepts, how they evolved, not what were the concepts. So what was the thinking process of Hahnemann when he evolved all these things, which is there in his book of lesser writing, and a book on particularly written by Life and Work of Hahnemann by Richard Hughes. So these two books give you idea about Hahnemann's way of thinking. And when I know that what way he was thinking, then I could understand what made him to evolve organon. And the sixth edition, for which there are so many what you call as somebody says sixth edition is not correct and fifth is okay. That controversy is going on. But according to me, sixth aphorism is a complete one. There is nothing more can be added, nothing more can be subtracted. You can expand by explaining, but you can't extend. You cannot make 293 aphorism. 292, 292.
During these 50 years of practicing, we have still the same organon, but we have like enormous skyrocketing development of medicine, diagnostics and treatment of allopathic medicine. And you are still in the same space.
Yeah, I will tell you. Can you change anything in Bible? Can you add up anything in Bible? That is organon. That's number one. Number two, very important thing is that what Hahnemann said is now coming through even in allopathic system of medicines about the concept of disease, which now they are accepting it. In fact, Hahnemann was much ahead of these people today.
Could you please explain what do you mean by?
Whatever concept Hahnemann has given about the disease in terms of individualization and in terms of vital force and dynamicism of body and mind, that has been now accepted by allopathic system of medicine, which was never accepted. Earlier, they used to consider only body, head to foot, and that's all, anatomy, physiology, biochemistry. But one thing you should keep it in mind. There is a wrong concept that homeopaths don't diagnose, number one. Number two, homeopaths don't examine the patient.
They do live online consultations.
Yeah. And number three, very important things, homeopathic doctors don't require stethoscope.
Require.
This is what people had this concept, and this was further infused by allopathic doctors. Yes, homeopathy don't tell. But I'll tell you, Hahnemann in Organon is writing that diagnosis is the first thing you have to do it. Without diagnosis, you cannot go ahead. Where allopaths end, that means where allopaths end in practice, they diagnose and prescribe. That's all. That is their end. Diagnosis is the end of that. And then they give prayer. What? Homeopath? Diagnosis plus individualization. Much ahead. Every individual.
Yeah, but now you have to explain me something.
Yeah.
Because what we more or less think in Europe, that in India there are so many poor people, they cannot afford diagnostic, they cannot afford treatment, and that's why they look for homeopathy.
No, that is wrong. It is not that. No doubt they are poor, they are going for homeopathic, which is cheaper also, no doubt, than allopathic treatment, but it is not that. Now, in villages also, people are taking homeopathy because they want homeopathic treatment. You see, poverty is one of the reasons, but not the only reason. And mind well, homeopathic doctors practicing in villages where there are no things are available, like investigation, other things. There is where the acumen of a physician counts. You see, how you observe, what symptoms are there, signs are there, what diagnosis is there. There lies our acumen. So we have to study our system. See, our system is not away from allopathy. Till diagnosis, we are sailing in the same boat.
Exactly.
After diagnosis, we go ahead.
Yeah, I like.
Individualize. Therefore, the diagnosis becomes utmost important. So that wrong concept now has gone on. In fact, now homeopaths are better respected by allopathic doctors in Mumbai and cities.
Because of the...
Now their knowledge is also.
Yeah.
They realize that they also study same thing what we are studying.
Yeah.
In India, in our colleges, there is 5.5 years of homeopathic course, like allopathic. 5 years. Along with whatever pathology study, medicine study, gynecology, surgery, everything is being taught to a homeopathic doctor for 5 years. And over and above homeopathy.
Yeah, and as we know, Hahnemann was German, and homeopathy was born in Germany.
Yeah.
And we observe the phenomena of enormous development of homeopathy in India. What would you think is the reason? Is it because it fits your history or tradition of medicine?
I'll tell you. See, what has happened? That in India, population is too much. You see, a doctor gets large number of patients. When you go to village, large number of patients are seen. So first of all, availability of patient is there. Therefore, homeopathic doctor becomes more experienced than what European doctor becomes because they have no large number of patients. So here, because of people over there in India, we get experience. And since we have got experience so much, that it has now further evolved of individual doctors also who have evolved homeopathy further and further. You see, therefore, in India, the reason is requirement of doctors and requirement of patients. Both are equal. Large number of doctors, large number of patients.
Is there anything in tradition of healing in India that fits homeopathy?
Very much. Because homeopathic is based on spiritual science. It's a spiritual science, homeopathy. And in India, spiritual aspect is very highly evolved from years together. So they are parallel to each other. The basic fundamental principle of homeopathy in relation to the spirituality is very much similar to that of Indian philosophy. So they go together.
Just give me some examples.
Example is Hahnemann talks that you treat the patient so that he is able to attain the higher purpose of existence. That is aphorism 9 in Organon. Higher purpose of existence. What is that higher purpose of existence? That is important. What he means by that we'll take up later on. Same thing, Indian philosophy says that our high and only purpose in living ourselves, in existing, is to serve human being and gratitude to God. That is a fundamental principle of Hindu philosophy.
This was philosophical
Yeah.
similarity,
Yeah.
but
Yeah.
could you please tell me some interesting example of, for instance, Ayurvedic?
Yeah. See, in Ayurveda, Indian medical science is based on Ayurveda. And Ayurveda has a basic two principles. One is the constitution. We have to correct the constitution and not the environment. Correct the constitution, everything is okay. That is what even homeopathy says, the same thing. That is number one. And number two, very important thing is that law of similar is depicted in Ayurveda, but it was not evolved. So, principle of similarity has been already existing in Indian Ayurveda system long many years back, but it was not developed, evolved further, which Dr. Hahnemann did it. And therefore, you find that Indian medical science, Ayurveda, is very near to homeopathy.
What you like about nowadays medicine, modern medicine, and what applies to your homeopathic mind and
See,
treatment?
one thing I must admit that modern medicine has evolved too much in various clinical conditions. You see, what we were learning about the gastric trouble in those days, and now the gastric trouble much more ahead. So much advancement has taken place and research has been done as far as understanding of clinical condition is concerned. Now we have tremendous deep knowledge and insight of every disease, which definitely allopathic system of medicine has evolved. Second thing that allopathic system has evolved is surgery, which is far, far ahead than what even 20 years back I used to see. It has evolved to a great extent. In homeopathy, on the other side, you see, there has been evolution in terms of posology, means potency selection, drug manufacturing. New drugs also have been proved. So there is there, but it is within the bracket of principle of homeopathy which has been depicted by animal.
Do you think this development of diagnostics has something to do with the remedy choice, or do we have some clinical implications?
There is no relationship of diagnosis and selection of remedy. There is no relationship. The relationship of diagnosis and remedy selection is only related with that in a particular clinical condition, particular drug was given. That's all. But you cannot prescribe on the basis of diagnosis. You have to individualize further.
Mm-hmm.
You see,
Yeah.
you can't say I am treating typhoid. I am treating a man with typhoid.
Yeah, this is so obvious, yeah, but so difficult.
Now, same thing in typhoid. You have typhoid, she has typhoid, another patient. Drugs are not same in homeopathy. Drugs are varying.
The first example you gave was typhoid. Did you happen to treat through typhoid?
I've been treating so many fevers in acute conditions. You see, may it be typhoid or may it be malaria. Homeopaths are now treating all the diseases. And that is what has happened in India in a big way. People are coming now in acute condition also.
So, what are your experiences with typhoid fever?
If you ask me typhoid fever,
Yeah.
naturally we'll have to know in which week he has come to us. So first week the drug may be different, second week the drug may be different. And when there is complication of ulcer and all those things, then the drug is different. So the variation of medicine may be there according to the stages of the disease.
Mm-hmm. So, for instance, acute, what would you think of?
That means you have now group of drugs are there. Acute, very acute drugs like aconite, belladonna, stemmonium, hyoscyamus, this. Then comes second group of drugs like pulsatilla, gelsemium in second week,
Oh my
much
God.
deeper. And third week, nitric acid, muriatic acid, because perforation and all complications.
Yeah, because typhoid is syphilitic miasm.
Miasm changes according to the stages of the disease.
Is there any particular field of medicine you are interested or experienced?
See, I've been since 2014. I have been focusing on treating multiple sclerosis cases. I have at least now 25 to 30 patients of multiple sclerosis. You see, and they are being not only treated by me, but they are also being monitored by neurologist, who is my friend, and we have a group of that. You see, so that now work is going on.
So, what is your approach to multiple sclerosis?
See, approach is same as what other cases are there. We take the history properly. We try to understand the patient as a person, and then we try to analyze. But very important point is management. You see, up to selection of remedy, everything is same.
Mm-hmm.
Maybe any disease. You see, but when it comes to management, see, multiple sclerosis also patient comes in a different stages.
Mm-hmm.
You have simple primary sclerosis, or you may have secondary one, or you may have complicated one. So according to that, at which stage he has come to me, accordingly my prognosis will be there. I have at least 5 patients who are in remission since last 15 years. They are in remission, and there have been testimonial. We have taken video also of these patients, and not only that, these patients are sent to me by Multiple Sclerosis Society of India.
And what would be the particular symptoms that are very important or more important than the other symptoms for the remedy choice?
You asked me a huge question,
Yeah,
which has
please
no
go.
one answer, because see, Hanuman has said to us, any case, you peculiar query if you get, you pick up and prescribe, whether it is acute or chronic. Peculiar query if you get. If you don't get, or if you are not able to find out, make totality of symptoms. Make totality and then prescribe. And still, if there are no symptoms, so there are very few symptoms, then just consider disposition of the patient and prescribe the drug. In multiple sclerosis also, same thing happens. When a person is in remission, he is taking allopathic also and many other drugs. He was a person who had psoriasis along with multiple sclerosis. But simple observation when I made during the interview, because he was he was not that intelligent to give answer properly and everything. Nothing was. It was very difficult to get history from the person. And a video I have got, I'll show you in future. Same person. So he could not answer me much thing. Then I said, I was observing him then only, his behavior, his way, gesture, and all those things. And I asked him, you take out your shirt and show me your psoriasis. So he's fumbling so much, he can't remove the buttons properly. It was very difficult for him to remove the shirt. Psoriasis with multiple sclerosis. This is the only observation I have. And he was not able to give the history properly. And when this was being observed, I asked you one or two simple questions which he can answer to me about desire and aversion and all those things. Mind well, you know what drug was given to him?
Baraita?
Baraita was given as a main drug. But when he was coming for all these things, at that time, when the psoriasis was in rampant, itching and this and this, and still he was cool and calm, but not very much disturbed like arsenic and belladonna and all those things. Simple sorinum was given. Sorinum. As an acute, not a constitutional, right? It's constitutional Baraita, or you say rightly. And mind well, he's running on the road now. This is a case of 2014.
Yeah, but what comes to my mind is if you cure at the same time multiple sclerosis and psoriasis,
Both.
my thinking would be if there is aggravation of psoriasis, maybe it is cure of multiple sclerosis.
See, I will have to clear this point rather. You see, we should not go with the idea that every time aggravation has to occur. But if it occurs, whether it is a disease aggravation or it is because of medicine, that we'll have to differentiate, no?
So was it aggravation because of disease or
Medicine.
medicine?
So how to differentiate? If your drug is wrong, disease aggravation is there. If your drug is right, medicinal aggravation is there. But how to differentiate? Patient comes with aggravation, that's all. How to differentiate? And that is the point where we have to understand Organon, where he says, you must see that with all the aggravation, if general condition is better, if the mental state is better, and he is able to communicate in spite of aggravation, that is a medicinal aggravation. And if it is a disease aggravation, he is havoc and he is having even mental disturbance and everything, no appetite, no nothing. This is the difference. So every case may not have aggravation, that we have to keep it in mind.
Mm-hmm.
And if it occurs, then you differentiate.
Dr. Mehta, it was a pleasure to talk to you, and I hope you will like to share knowledge to our listeners about particular topics.
Thank you very much. Even I am very happy to see you coming from Poland to here. It is something unusual and really great for you. And I really am having gratitude towards you. Thank you very much.
Thank you.